Hi, everyone. This is Rachel, the project coordinator for our Early Psychosis Learning Collaborative. Please feel free to introduce yourself in the chat box. And now I also just wanted to review a few housekeeping items with you all before we begin. Participant microphones will be muted at entry, and you'll be able to unmute them during the discussion portion. And during the presentation, if you have any technical difficulties or questions about the topic, please feel free to use the chat box. This session is being recorded and will be available for viewing at a later time on the MHTTC website. And to reach us after the webinar, you can email newengland@mhttcnetwork.org. Next slide, please. And this slide here provides a description of our disclaimers for MHTTC. Next slide, please. And the MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. That language is strengths-based and hopeful, inclusive and accepting of diverse cultures, genders, perspectives, and experiences, healing-centered and trauma-responsive, inviting to individuals participating in their own journeys, person-first and free of labels, non-judgmental and avoiding assumptions, respectful, clear, and understandable, and consistent with our actions, policies, and products. And with that, it is my pleasure to hand it over to Dr. Macheri Keshwan for introductions.
Thank you, Rachel. And may I have the next slide, please? Yeah. Good afternoon, and hope all of you are well. Welcome to the first in the series of wellness-oriented webinars in the context of our COVID pandemic. The New England Mental Health Capacity Building Center, called MHTTC, supported by SAMHSA, and led by a group of investigators at Yale, including Larry Davidson, has launched a series of initiatives to help people develop wellness skills in the context of COVID-19 pandemic, with a specific focus on healthcare workers and first responders. So we all know that the pandemic is still raging on. Thankfully, in the US, it is really in the downward trend, even though so far, as of today, or about 33 million people have been affected, and over 600,000 people have lost their lives. And by contrast to the United States, the rest of the world, many other countries are still suffering a raging pandemic, with the global world total of people with the infection is around 168 million as of today. And about 3 million people having lost their lives. So this is unprecedented. This pandemic has affected our lives, almost everyone in one way or the other. And so it is useful to think about how are we all coping about this. Having risk factors of one kind or the other is nothing unique to any one of us. It happens all the time. The last 1 year since the pandemic began has been an unprecedented global stress. But stress is nothing new. And we always walk a balance between risk factors in our lives and potential protective factors. It's a balance. And how do we strike a balance in these unprecedented times? Next slide, please. So this balance could be tilted in favor of adversity, of risk being predominant, by many factors that we see around us in the COVID pandemic times. First of all, the viral illness itself, the COVID risk in oneself and or loved ones, the many comorbid medical illnesses that many individuals have, and also occupational aspects, especially in those who are in the front lines, healthcare workers and and frontline responders. Burnout is an exhaustion, and hopelessness and demoralization are big issues. For many others in our society, job loss, closed schools, these are big issues. At a personal level, loss of sleep, loss of exercise, sedentariness, social distancing, loneliness, fear, misinformation, and also the reluctance to seek care, stigma issues. They all weigh in favor of adversity and enhancing risk, and thereby tilt this balance of health. What do we do about this? How do we build balance back into our lives? Next slide, please. This balance can be achieved by reducing risk and increasing protective factors. There are many of those things that are in our hands, improving our own attitudes and approaches and lifestyle. There is a veritable toolbox that is available in the mental health world that can help us move towards health and actually build and become stronger. This is particularly important now, even as the pandemic is settling down, because as the viral pandemic is settling down, we are beginning to see increases in mental health problems. Our hospitals are getting, psychiatry departments are getting overcrowded, the emergency rooms, inpatient services, and so on. So there is a lot that can be done at an individual level in terms of self-care to reduce the risk and to enhance our protective factors. Of course, vaccines are important. Integrated care of medical illness is important. Exercise is important. Healthy sleep is important. Enhancing social connections in the era of social distancing is important. Limiting over information. Too much information can be toxic. And also sharing our feelings with others and seeking help are critically important. All of those will serve to reduce risk and enhance the protective factors. But there is a third element in what we can do, and that is to build our own inner resilience. So to bring balance, not only do we balance the two sides of the balance, but also we have to work on the fulcrum, if you will. So if you go to the next slide, we have a lot we can do that's in our own hands in terms of building resilience. We can work on that apparatus, which we call the mind and the body. And there are tools that are available, including mindfulness practices, acceptance and engagement, yoga. All of these are techniques that can help us build a stronger core, if you will, and build our resilience. With that as the background, we are starting this series, next slide please, of wellness-oriented webinars, the first of which is today by Dr. Michelle Friedman-Yakubian on one of these tools in our toolbox, which is the approach of acceptance and commitment. But ahead in this series, we will also see a number of other sessions on yoga, interactive sessions with exercises built into those, mindfulness-based resilience building by Nicole DeTore and colleagues, sleep hygiene by Tony Cunningham, enhancing positivity by Shirley Yen, and other upcoming topics on music and wellness, addressing problems of substance abuse, and meditation aspects, and so on. Joining me in this team for this series are Raquel Meshulam-Gately, the psychologist in our team, and Rachel Hegde. So with that, let me move on to the next slide, which will be the first slide by Dr. Meshulam-Gately. But by way of introduction, Michelle is a psychologist with expertise in psychotherapy of people with serious mental illness and addressing problems in the earliest phases of serious mental illness when people are still at high risk for this disease. She directs a clinic called the CEDAR program and has developed her expertise on many aspects of psychotherapy, including mindfulness and acceptance and commitment approaches. So Michelle, take it away.
Hi, everyone. Thank you, Dr. Keshavan, for that introduction and for setting the stage for this series, which I think is going to be very helpful to many people. I want to extend a welcome to all of you that are joining and really encourage you to use the chat to introduce yourself and let us know where you're tuning in from. I'm very excited to talk about this topic today. It's going to be a very different kind of presentation for me. It's a lot more personal for me than a lot of presentations that I've given. I usually talk about mindfulness and acceptance practices with young people that are experiencing early signs of psychosis and their families. But today I'm talking about how healthcare providers, and that includes myself, can use ACT to enhance well-being and to try to reduce burnout. I'll be sharing some practices that I use in my own life and I try to share with supervisees and colleagues in my practice and in my work. And I really get that we're meeting over lunch hour and life is so busy right now. So I have no doubt that many of you have probably made some sacrifices with your time in order to attend the webinar today. Many of you are also likely to be multitasking, responding to emails, eating your lunch while listening in. And I just want to invite you, if it is at all possible for you, I'd like to invite you to make this next hour a time to really focus in and participate in the discussion today. I really want to invite you to think about and try the exercises and activities that we're going to talk about in order to start making some positive changes in your life. And if you're willing to be brave and turn on your camera, it's wonderful to see you. If you're up for that at all, I don't mind if you're eating or doing other things, but I love to see faces. And I also will ask you to participate by typing some things into the chat, or even if you're brave enough to turn on your microphone to share directly during aspects of this talk, I would really welcome that as well. So I'm going to be providing an overview of acceptance and commitment therapy and practices, and also talk about how to use ACT practices to enhance well-being and cope with pandemic stress. So acceptance and commitment therapy is pronounced as one word, or ACT, is a set of theories and beliefs about how people work, how people get stuck in their lives, and how to help people get unstuck. ACT focuses on the skills that are necessary to live and develop a rich and meaningful life. This is accomplished through acknowledgement and acceptance that pain, discomfort, difficult thoughts and feelings are natural and they're an unavoidable part of life. The goal of ACT is to help individuals let go of some of the habitual practices, maybe the unconscious things that we do, that we engage in order to try to get rid of feeling bad or avoid any of these sort of difficult thoughts and feelings. This is also known as something called experiential avoidance. So the goal of ACT is to create a rich, full, and meaningful life while accepting the pain that inevitably goes with it. So according to ACT theory, symptoms are not why people get stuck. The main problem is the efforts that people go into it in order to avoid having unpleasant experiences. For example, behaviors like staying in bed all day, using substances, avoiding friends, Or like me, it might be eating that entire box of Triscuits while getting ready for this talk today. All of these things can be understood as avoidance tactics that strip vitality and meaning from people's lives. And these habits can be really hard to break. In ACT, the way to break these habits is to get in touch with your personal values and to mindfully live life according to those values while accepting the unpleasantness that can inevitably come up when doing things that really matter to you. So here's your first opportunity to participate in the chat. I'd like you to take a moment and consider this question. During the past year, what has caused you physical or emotional pain at work? Don't be shy. Good, I've got some stuff here. I've got worrying about getting COVID, limited access to personal protective equipment, high demands of clients, lack of flexibility, multiple losses. These are all really important things. This has been just an unbelievably difficult year. And I think that healthcare workers are among the folks who have been most impacted by this, though it's the impact of the pandemic has been so broad. Thanks also clients struggling with symptoms and feeling unwell, vicarious trauma, working with those in crisis during the pandemic. So thank you for sharing these. What I'd like, if you're willing to do now, is take a moment to kind of think about considering these painful experiences and emotions that show up. Maybe it's sadness, frustration, anger, shame, boredom. Take a moment to consider what are some of the things that you've tried for getting rid of them? Have you tried to do things to distract yourself from the feelings? Maybe it's watching bad TV or avoiding certain situations that you know you really need to get to. Have you opted out? You quit something that you used to participate in order to be able to avoid some of the difficult feelings? Are there ways that you've been thinking about the situation to try to think your way out of the feelings that you're having? Have anybody engaged in using substances or other kinds of things to try to feel different? I see lots of really good things that folks have put into the chat, taking some time out from work to restore mental health, accepting limited access to PPE to quell anger. That sounds really painful. Going out for a walk, yoga, selected use of technology. Thank you, Selena, for sharing some of the ones that I think many of us are secretly thinking about, like overeating and sweets and kinds of things like that as well. So lots of things people have tried. All of you are working in areas where you're highly educated. You know, you're doing many things that, you know, the books and magazines that recommend how to deal with stress would recommend doing. And I guess I want to just ask you this question. How have these tactics worked, you know, in terms of short term and long term? I saw an example. What are examples of opting out? This might be somebody who stops spending time with friends because it's just too hard to talk about what's going on in your life with them and it just feels too painful. Or kind of not bothering to apply for a promotion because it seems too hard. Any thoughts on the short-term and long-term consequences? Has anybody figured out a way to get rid of anger, shame, boredom, frustration? Yeah, I haven't either. So I'm seeing some no's in there as well. when we're considering sort of some of these painful experiences, also, have there been any costs that have come from some of these tactics? Stop visiting with friends because of the complex medical conditions they often discuss. What are some of the other costs? Feeling unhealthy, for sure. I think there are many, many health consequences of some of the stress and experiences that we go through to try to avoid them. Feeling stagnant, I like that word. So feeling kind of stuck. And I think that is something that many, many, many people can relate to right now. We've kind of been in this holding pattern over the last year, just trying to get by. So as far as I know, nobody's figured out a way to get rid of painful thoughts, feelings, emotions, sensations. There's lots and lots of things we try. Some of them work in the short term, but nothing makes them go away forever and not come back. So, we think about, what is happening, when you struggle with pain that inevitably shows up in a rich, full and meaningful career. So we're going to get back to that question, but a primary focus of ACT, I have sort of a metaphor to start off with, is to help people let go of what's known as the control agenda, also known as unwillingness or experiential avoidance. These are all the things that humans do unsuccessfully to try to make unpleasant experiences go away. And the chronic use of these strategies leads to something we call psychological unflexibility. So in this kind of picture here, we've got this feelings monster. The feelings monster's got unworthiness, self-doubt, fear, anxiety, sadness. These are all emotions that we get to experience as part of being human in our lives. And this poor guy over here is holding on for dear life. He's doing whatever he can to try to stop that monster from pulling him right into the pit. And while he's holding on and trying to fight this monster, how well is he able to take care? Let's say he works as a nurse. How well is he able to take care of his patients and really pay attention to what they need? Folks can feel free to unmute and shout out sort of responses if you're up for that. How well is he, how good of a friend can he be? Can he really be there to kind of help friends that are going through some difficult times? How well do you think this guy is sleeping at night when he's holding on to all of that? Probably pretty hard. He looks pretty tired. So what's the alternative to struggling to control emotions? So here we've got this guy. What has he done? So he's let go of the rope, right? So the rope is now there. Is the feelings monster gone? Nah, he's still there. In fact, the feelings monster can, the feelings monster's laying down there because it was surprised when he let go of the rope, but he could certainly get back up and he could start yelling at the guy again and tell me like, I know you want to get rid of me. You're a loser. You're still a loser. You can't do anything right. So it's not that the feelings are gone, but now this guy has some release from the tension. Exactly. Thanks, Janine. And maybe he's got a little bit more energy that he can devote to the things he really cares about. When he's not holding on to the rope, can he take care of his patients? Can he be a good friend? Can he sleep? Probably a whole lot better than he was able to when he was holding on to that rope. So now let's consider what this might look like for an individual. I'm going to talk about Maria, who's a composite of folks I've known in my life. Maria is an attending physician in internal medicine. She's working on a COVID unit, and she's been seeing death and dying on a regular basis. Her department chief regularly makes racist comments that make her very uncomfortable, and she generally does not show very much respect for her or her work. Maria has considered looking for a different job, but she worries she would just encounter the same problems anywhere she would work. She also has significant stressors at home, including a partner who contracted COVID several months ago, but who continues to experience mild long-term effects that have influenced their ability to work and contribute to childcare. Also, her son has recently been diagnosed with dyslexia, but the charter school that he attends is pushing back and denying the services that he needs to be successful in school. Maria comes in for therapy complaining that she can't shift her attention to other things at the end of the workday. She's having trouble sleeping. She feels irritable with her students and her coworkers, as well as her family at home. She's been drinking more and she intends to, and she stopped responding to invitations from friends to get together. She feels like she would just bring everyone else's mood down and feel like there's no time for her to do anything for herself. She compares herself with her colleagues, and she notices that everyone else seems to be able to handle things better than she can. So I'd like you to take a moment and consider Maria. Can anybody identify what are some ways that Maria is struggling? What are some ways that Maria might be holding on to that rope and struggling with her feelings? And can anyone relate to some of these things that Maria is experiencing? Type things into the chat. Thank you, Marielle, for agreeing that you can relate. Working as a single parent, time constraints. Are there any ways in which Maria might be struggling to, kind of struggling with her feelings, maybe kind of telling herself that her feelings are wrong and that there's nothing that she can do about them, or that she shouldn't be feeling the way she's feeling? She's experiencing guilt and shame. Thank you, Greg. Divided between work and home, very stressful. She's feeling bad about feeling irritable. Yeah. Would folks say she's feeling pretty stuck? Sounds like she's in a pretty terrible work situation with her supervisor. Yeah, she feels like there's nothing she can do about it, and she doesn't have the energy to kind of take action to help protect herself. Yeah, she's feeling bad about feeling irritable. Great. So lots of ways in which Maria, has very incredibly understandable stress in her life. Yet, even though I think anybody who's in this webinar could understand why she wouldn't be concentrating as well as she used to, she's not able to see that from up close. She's berating herself about feeling irritable, about not concentrating. She's feeling like, there's nothing that she can do. So what might be some things that, if Maria could get some support in letting go of some of that struggle and letting and accepting some of her feelings, being there, of acknowledging and recognizing and being kind to herself. What are some ways that, what are some steps that she might take that would help with that? So perhaps maybe she could acknowledge and recognize that her feelings are completely understandable and make sense. She could stop giving herself a hard time and telling herself the story that all of her colleagues are so much better at handling this than she is. That something is wrong with her, that there's nothing that she can do. She can, thank you, Leonardo, she can validate her feelings. Exactly. Okay, so we're going to talk more about what this might look like in lots of different ways. I think you guys are really catching on to this idea of dropping the rope, of accepting the feelings and letting them be there. So another thing that we sometimes talk about is this idea of the struggle switch. So, you know, the goal of ACT is to make space for difficult internal experiences while taking action towards values. So on one side of this picture, the struggle switch is on, and this poor guy is saying, you know, anxiety, I don't want anxiety, I don't want anger, I don't want agitation, I need to get rid of this, this is bad, I don't want this, I don't want this. And what happens to those feelings? They actually get bigger, they get amplified, because now he's having feelings about his feelings. He's having anxiety, he's having anger, and then he's feeling shame and sadness about feeling anxiety and shame and anger because other people have it worse than he does. He's in this whole sort of storm, right? Over here, this person has the struggle switch off. You know, this person says, here's anxiety. I don't want it, I don't like it, but I'm not going to struggle with it. I'm going to accept that it's there. I'm going to leave it be. And sometimes it's going to get really high and it's going to be really overwhelming. And sometimes it's going to be low and I'm going to have relief from it. But I'm not going to struggle with it and try to make it go away in a way that actually amplifies it and makes it worse. So this is called the ACT triflex. These are a variety of different practices that are involved in practicing just that, what we've been talking about, dropping the rope, turning off the struggle switch, giving space for internal thoughts, feelings, experiences while doing things that really matter to you. And we're going to talk about each part of this triflex in a little bit more detail. So the first part of this is called Be Present. This involves making contact with your inner experiences, your emotions, your feelings. Other words for this that folks may have heard are mindfulness, or this idea of self as context. Mindfulness means paying attention on purpose to the present moment without judgment. So as human beings, we have an amazing ability to remember the past, which helps us to learn from our mistakes. It helps us to anticipate the future, which helps us to plan. However, for many of us, our minds can sometimes be like out of control time machines, either constantly pulling us into the past, reliving old hurts, going over and over again in our minds about a difficult conversation we had at work, or pulling us into the future, worrying and thinking about all the things that can go wrong and all the things that we have to prepare for in case they do. And in the meantime, we can miss out on what's happening right now in the present moment. And so the practice of mindfulness is really about that. It's about taking some moments during the day, every day, just to practice being present, to practice kind of taking a non-judgmental stance to your own bodily experience, your thoughts, your feelings, and to practice being in the present moment. There are a whole lots of ways of practicing mindfulness. Lots of them look like meditation, but that doesn't necessarily work for everyone. There are mindfulness exercises that can involve just even listening to music and just giving that your full attention, or playing with a pet and really just, you know, taking in how wonderful they are or observing a child and just looking at their magnificence and kind of noticing how engaged in the present moment a young child can be. One that I thought we could try together, if you're willing, is it's called clapping, and noticing how long the sensation lingers on your fingers. So we're going to try this one together. If you're ready, I'm going to ask you to first just take a minute to rate yourself 1 to 10 on how present you currently feel. You know, a 10 would be like, I am just so involved and engaged in this webinar. I'm totally listening to you. And I've, you know, I am, my mind is not elsewhere. 1 is, yeah, I'm barely paying attention to you because I am thinking so much about something in the future or in the past. Okay, just think that to yourself. And then in a minute, I'm going to ask you to clap your hands together and just notice what that feels like in your hands and your arms. Before we do that, I want you to take a moment just to get comfortable in your seat. You might uncross your arms and your legs. You might relax your shoulders a little bit. You can do this exercise either with your eyes open, your eyes closed, whatever works for you. And at the count of 3, I'm going to ask you to just clap your hands. So ready? 1, 2, 3, and clap. So now just notice the sensation on your hands. When you did that, did anything else change? Did your heart rate increase? Maybe your breathing changed a little bit. Maybe you started feeling a little bit more awake. Maybe take a nice slow breath in through your nose, all the way to your belly, as if you're filling it like a balloon. If you notice your mind wandering, just gently acknowledge that and turn your attention back to your breathing and the sensation in your hands. Can you still feel the gentle sting from the clapping? Okay, in a moment, just take one more breath in and out. Relax your hands. And bring your attention back to the webinar. And if you had your eyes closed, you can open them again. And if you're willing, I'm curious if anyone noticed anything they'd be willing to share about what that exercise was like for you. I appreciate someone said the clinic is too quiet to clap right now. That totally makes sense where you're at. And also somebody indicated that they like the clap experiment for my young children. Did anyone notice? I can still feel the clap on my hands. Did anyone notice that that lasted a lot longer than you expected? Yeah. Yeah, I see lots of yeses about that. So lots of ways to practice mindfulness exercises. At the end of this webinar, I've got a bunch of websites. If folks like to have a guided mindfulness exercise, I've got lots of websites I can recommend. Another tool for opening up to the present moment is to practice recognizing what we call self as context, which really means just recognizing that situations happen for people and they can shape your perception of yourself, but they don't define who you are. In a lot of ways, people are like the sky. Sometimes the sky is covered with clouds, rain, storms. Sometimes there's sun. There isn't one version of the sky that is truly the sky. The sky that happens to be overhead in Southern California is more likely to show blue sky a lot of the time and sun and warmth compared to the sky in Alaska. Just like a person who's working in maybe a really difficult work environment might not be putting forth their best work in that situation, but it doesn't define who they are. And that same person might function very differently and look very different once they move to a position that's a better fit for them. I mean, think about Maria, who's dealing with an incredibly difficult, challenging boss who's doing things that are frankly not legal. And think about how she might feel in a different situation, in a place where she's truly valued for the work that she's doing. The next area I'm going to talk about is called open up and make room for all the thoughts and feelings that you have without resistance. And we're going to talk about two things called defusion and acceptance. So when it comes to acceptance and willingness, again, this really means allowing thoughts, feelings, and internal experiences to be as they are. It's being willing to think what you're going to think and feel what you're going to feel, and to recognize that those things inside your skin, you can't change. They just are. And to make space for them, to make room to drop the struggle, and to invest your time and energy into what you can change versus trying to change and berate yourself for your own feelings. In a lot of ways, this is reminiscent of the Serenity Prayer from AA. God grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. There are some misconceptions about acceptance. Acceptance does not mean passively accepting a bad life situation rather than taking action to change it. Okay, so acceptance is not about putting up with somebody treating you poorly. It is about recognizing that it's going to be difficult to stand up to that person and change your situation. It's not bucking up, it's not a technique. It's a process that involves practicing being willing to make room for thoughts, feelings, and internal experiences while doing that show up for you while you're doing the things that matter. Another way to understand the practice of acceptance is to consider the difference between pain and suffering. So let's consider this guy. We can call him Bob. Bob's a nurse in an emergency room that was converted to an ICU for COVID patients. He has just discovered that he made an error and he administered the wrong medication to a patient, which could have been fatal if his colleague had not noticed it when they did. Bob is understandably feeling pretty terrible about this mistake. There's no way around feeling painful emotions in this situation. But whether the painful feelings become amplified depends on what happens next. In one scenario, Bob admits the mistake. He apologizes and approaches the situation with curiosity to learn from his mistake and to ensure that it doesn't happen again. Bob moves on and continues to help patients, and the painful feelings associated with the mistake gradually dissipate over time. In another scenario, Bob is overwhelmed by feelings of shame. He blames his colleagues for distracting him rather than admitting the mistake. He berates himself and tells himself he knew he would never be a competent nurse. He yells at his family that night, maybe drinks, tries to get rid of the painful feelings. He winds up staying too late playing video games that he uses to distract himself, and he's late for work the next day. Okay. So in scenario two, Bob does a lot of understandable things. I think all of us can recognize that scenario in ourselves. All of us engage in behaviors that turn pain into suffering. It's part of being human. And, those attempts to try to get rid of those feelings, those make his suffering worse. They amplify the difficult feelings and make them last. So we can think about relating to our difficult feelings like this young person here who's offering her fears some more tea. She realizes that you can't get rid of her difficult feelings, but you can learn to live with them and you can make space for them, and she's even befriending them. The next piece that we'll talk about is this idea of cognitive fusion. So what this means, cognitive fusion means any fixed beliefs, rules, judgments that seem like self-evident truth to a person and influence their willingness to engage in valued actions. Okay. Cognitive fusion can be kind of like wearing glasses that highlight the belief. And yet a person can almost not realize they're wearing the glasses because it just seems like what is, you know? So here's some examples of fused beliefs that could be very common that would show up at work. Things like, I don't know what I'm doing and everyone knows. I don't have time for a social life. I'm too anxious, depressed to do something that's important to me. Everyone else can handle this better than me. And when we're trying to kind of work with cognitive fusion, we're trying to help the person take a moment to almost, it's like taking the glasses just a little bit further away from your face. You know, you might not be able to, you know, honestly, I can't see very clearly when I do that for myself, but at least I can see around them, and I can realize that when I'm looking through that lens, that it's actually my viewpoint. It's not just self-evident truth. It's not just what is. Kind of further demonstrate this, we're gonna do an exercise together. I'd like you to take a moment to kind of think about, if I could listen in on your mind when it's really beating you up, what you might hear it saying. Like if you could listen in on my mind, on any given day, you'd probably hear me having thoughts like, I'm incompetent, I'm a bad parent, I'm lazy, I spend too much time working, disorganized, like all these kinds of things. The one that I'm going to sort of focus on right now is the idea that I'm incompetent, because that shows up a lot. I'm like, who am I to kind of tell other people how to live their own life and engage in enhancing well-being when I struggle with this on a daily basis, right? So I'd like you to do is just think of, you don't have to share this one, but think of a nasty belief or judgment that about yourself that has shown up for you recently. And I'd like you, for the next 30 seconds, don't have to do this out loud, but it can be really interesting if you're in a private space where you can and your microphone is off. I want you to just repeat it, fuse with it, think about it, just very vividly. We're gonna do this for 30 seconds. Okay, ready? So for me, the thought is I'm incompetent, and I'll just be repeating that to myself over and over again. If you're willing, of course, totally voluntary. Ready? Go. Okay, now I'd like you to think of that judgment again for the next 20 seconds, but this time I want you to add this phrase first. I'm having the thought that. So for me, I'd be saying, I'm having the thought that I'm incompetent. And I just want you to take a moment to try that out. So I'm having the thought that, and fill that in with whatever comes to mind for you. Okay, now I'd like you to add one more phrase, and that is, I'm noticing I'm having the thought that. So for me, I'd be saying, I'm noticing I'm having the thought that I'm incompetent. And if you're willing to share in the chat or by turning on your microphone, let me know, what did you notice? Did anything happen while you were doing that exercise? Did anyone notice? Awesome. So some greater self-compassion with the additional phrases. Saying, I noticed the thought gave me some more distance. Yeah. And again, everybody will respond to these different experiences in different ways. So if you didn't, I think a very common thing that folks notice is a little bit more compassion, a little bit more distance. If that didn't happen for you, you didn't do it wrong. It just means that this isn't the right way for you to practice defusion. There's a million different ways to try. Somebody noted there was a shift between acknowledging the thought and accepting the thought. Here's some more ways to practice defusion. Another way is sometimes talking about or noticing the mind. Sometimes talking about your mind as if it was like another being within you can be interesting, because it can sometimes give you a little bit of space to kind of notice, what is your mind telling you right now? My mind was telling me, when there was silence in the webinar, that everybody had sort of left and nobody actually did the exercise, and I was going to have to make up something about what happened. Ask yourself, how useful is it to get all caught up in what your mind is telling me right now? Okay, so when I'm really caught up in this idea that I'm incompetent and I'm a loser, am I able to kind of really do things that matter to me? Or do I need to make space for that thought and kind of recognize that my mind tends to go in that direction while, I go ahead and I perform it and do things as confidently as I can? Or another way can be to consider, how long have I had these fused beliefs? Are there some early life experiences that contributed to developing these rules, judgments, and beliefs? Sometimes when you really ask yourself that question, you might realize that when you're arguing with your partner, that certain feelings are showing up for you that remind you of something that used to happen with your parents when you were very young, or used to happen with teachers when you were very young. Or that certain feelings, emotions are showing up because the situation is reminding you of something, or a belief that you developed about yourself at a time when you had no choices in your life. And that in your current state of adulthood, that maybe there are more choices about how to behave, and that the kind of habitual practices that you developed in childhood maybe aren't serving you anymore. And now we're going to move into doing what matters. So these are values-guided action, committed action. I'm going to briefly talk about the difference between values and goals. Okay, so a lot of times when you ask people about their values, it can take a minute. You might hear things like goals, like I want to lose 10 pounds, or I want to find a partner and get married. But those are really goals. A goal is something you either do or don't do. A value is a direction that you move in. So similar kind of analogy might be thinking about, if a sort of living person can do the thing better than a person who's dead, then that's sort of a thing that you're thinking about. So a person, so losing 10 pounds. Might be something that this is kind of a difficult kind of thing to think about, but it's something that isn't a living person goal. But like thinking about, if I lost 10 pounds, what are the things that I value, the ways that I could be in the world that I would really matter to me? So would I be healthier and have more energy, which would allow me to be more involved in my life and be more active and join a sport team that I've been interested in participating in. One metaphor that can be helpful for thinking about values is the miracle question. So I'd like to invite each of you to try this out. Take a moment to think to yourself, imagine if you discovered a magic pill that you could take tonight and it would eliminate all the difficult thoughts, feelings, and experiences that you're currently struggling with. And they would just go away while you were sleeping tonight. What would you wake up and do starting tomorrow? What would you start to do with your newfound freedom from difficult internal experiences? Would you ask someone on a date? Would you stand up to that person who's making sexist comments at work? Would you change your work hours so that you could spend more time with your kids? What would the first step of that be? Is that something that you could do now, even though those difficult thoughts, feelings, and self-doubts are still playing on in the background while those are happening? Another tool that can be useful for starting to think about the actions that you want to take in your life is called the choice point. So there are two kinds of behaviors, those that can add to a rich, full, and meaningful life and are in line with your values. We call those towards values. And those that are not in line with our values and lead us to feel drained and stuck. You can call those away from values. And here's just some examples of things that people might put on their list, but everybody's list is going to be a little bit different. And then we can think about what are all the sticky thoughts and feelings that show up that might influence behavior? You know, what are the things that show up that might kind of lead a person who really values treating their patients with respect and dignity, spending quality time with their family, exercising? What might lead them to instead stay up late watching bad TV, ignoring their kids, mindlessly eating junk food? Maybe it's some of these thoughts and feelings that show up. And then when we think about the different skills that we've talked about throughout the talk today, you know, practicing acceptance, practicing mindfulness, practicing defusion techniques, remembering that the context of your situation has an enormous influence over your behavior and how you feel about yourself. All of those tools are kind of like helpers that can provide you with the strategies that can allow you to notice these thoughts and feelings and to make choices about what you do without these thoughts and feelings having so much power and influence over your behavior. So when you're practicing those skills and you're making space for feeling tired, lonely, bored, hopeless, you know, thoughts like, screw it, I can't do it, maybe even memories of trauma that are showing up. When you practice making space for those, acknowledging that they're there, then sometimes you can make the choice to engage in the towards values activities more of the time. And to have these thoughts, feelings, sensations, emotions have less power and influence over what you do. So here's a blank one, and we have the slides that we'll share on our website if folks are interested in filling out your own choice point. It can be kind of an interesting exercise to do. So a few final thoughts. I just want to put in a plug for thinking about, when you're thinking about doing what matters, that includes cultivating time for rest and play. Doing what matters does not mean that you don't make time for yourself, that you don't plan free time and restorative time. As well stated by Brene Brown, if we want to live a wholehearted life, we have to become intentional about cultivating sleep and play, and about letting go of the exhaustion as a status symbol for productivity, as a status symbol and productivity as self-worth. I want to urge you to take a few minutes today, think about how you want to use time ahead of you and give yourself permission to plan something that's fun and something that's a break from the caretaking that you do every day. I want to encourage you to treat yourself like someone you really care about. That can be, some examples can be things like scheduling a nap, planning a walk, you know, and a lot of times when we don't schedule a nap or make time for sleep, we wind up falling asleep anyway while taking care of our kids or doing something else. So it's about taking some time to be intentional and making that space and recognizing that you're human and have human needs. So I'm happy to take some questions if we have some time for that. I'd love to, but a couple of things I'll share. Here's a few books that I think really underscore some of the ideas that we've talked about today and are really approachable. Many of these are available in audiobook format, which I just find very helpful in my busy life for being able to do other things like laundry while I'm also taking in some of this content. And here are some websites that contain a lot more information about using acceptance and commitment therapy. There's some great exercises online, YouTube videos that are super helpful. And here's some of our upcoming events in this series, as well as other events that are sponsored by the New England MHTTC. And it would encourage you all to contact us with any questions, ideas for programs that you have. Thank you so much for your attention today. I just stopped the share. I don't know if anybody has questions. It looks like it's actually 1 o'clock, but folks are willing. My email address is in the slides, and so would be very happy to talk with folks if you reach out. And thanks all for folks saying thank you in the chat. I hope you have a good rest of your day and that some of the things that we've talked about together will wind up being useful for you.